Today's episode is brought to you by Provider Solutions and Development. With a projected shortage of 124,000 physicians by 2034, you need an excellent recruitment partner. Provider Solutions and Development is a leader in physician and APC recruitment because they do recruitment differently, with no commissions and no quotas. With their nationwide provider network, PS&D will work one-on-one with you to create a highly customized recruitment plan designed to find the right candidates for the job. Visit info.psdconnect.org/CareTalk to start the conversation today. That's info.psdconnect.org/CareTalk. Or just click the link in the description. Welcome to CareTalk, America's home for incisive debate about healthcare business and policy. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix. David, we have discussed gun violence at length before. We had that great interview with Dr. Annie Andrews, who's actually running for Congress now on a gun safety ticket. But unfortunately, the most recent news about school shootings, gun violence, and gun safety is back in the headlines with, I think there were 6 or 7 mass shootings just last weekend.
John, we like to hear ourselves talk. We like to feel we have some impact. Sad to say, we're not the only ones who haven't had any impact here. There's been tremendous loss, and probably even between now and when this episode goes live, we'll see more. And it's the mass shootings, of course, that make the news, but there are many more suicides, accidents, domestic violence, and individual shootings. And Congress hasn't acted, and if anything, the laws have become looser over the last decade or so. So let's talk today about what the medical profession is or could be doing about gun violence. And I wonder, John, does the medical establishment, such as it is, take a position on gun violence? What's the position they take?
Well, no, David, that is about the easiest softball you could have given me, because the AMA has had a position on this for many, many years. Pediatricians have been leading on this issue. In fact, the one of the big arguments bureaucratically has been the Republicans' unwillingness to fund just research into this area as a public health issue. But every public health department in the country, every public health research area has interest in this, because doctors have been very focused on the dangers of the epidemic that grows and declines, but grows in scale every year for many, many years now. And the literature is actually rich with dangerous and somewhat terrifying statistics, particularly if you compare the level of gun violence in the U.S., where you've got more guns than, many more guns than people, than any other industrialized country. And doctors actually have been leading with a number of different initiatives to research it, to fight it, and to frankly create a situation where access to guns and ammunition are a lot safer. But I guess my question back to you is, just because the doctors are in the lead, do you think we're making any progress?
Well, I don't think we've made a lot of progress. I think we've gone backwards, and you have to be pretty optimistic to think that much is going to happen. I don't think anybody expects a comprehensive solution, but let's talk about some specifics, maybe some small steps. And there is a bill passed by the House that's being discussed in the Senate, and the American Medical Association came out in favor of some specific elements in it. One is to increase the purchasing age for semi-automatic rifles from 18 to 21, keeping in mind an 18-year-old is not allowed to buy a handgun, but they can buy an AR-15. Banning.
They're not allowed to drink, and they can buy a military assault weapon with capable of handling large magazines, and whose sole design is to damage people's internal organs.
Yeah, that's what these are for. It's not just a dangerous product. It's a product designed to kill. So these high-capacity ammunition magazines, that's one of the issues, and bump stocks that came up briefly before. There's ghost gun loophole. I don't think is such a big deal. And then there's this other one about a federal requirement for safe gun storage and establishing strong penalties for any violations. Now, this in and of itself is, I don't think, going to get that far. The idea is that a lot of violence is done with guns that are stolen. So the idea is well, if you make it harder for people to steal them, there'll be less violence there. That's kind of indirect, but I think it's actually going in the right direction and points to the possibility of an American solution here, which is, suing people into submission for causing damage, whether that's somebody caused damage with a gun that you own or holding manufacturers responsible or something like that. That's the only way I can see we get anywhere.
Well, I think that I'm actually slightly more optimistic than that. I mean, it's only in the shadow of great tragedy, great gun tragedy, that we've actually made some modest progress. There was modest progress after the murders of our political leaders in '68. There was a modest progress even with a Republican administration and legislature in the state of Florida after that horrible shooting in Parkland. There is consistent, incremental, modest progress around gun safety and sensible gun safety legislation at a state level that's been really led by Moms Demand Action at a local level. You saw in the state of Colorado, they passed a red flag law and modest restrictions on purchasing assault weapons and ammunition. And the two Democrats who voted for that in the state House, State Senate were turned out of office. Moms Demand stayed in that state, organized, and actually turned over 4 or 5 seats back into Democratic hands, really focusing almost exclusively on issues of gun safety. And were successful at actually passing things like red flag laws that take the guns out of people who are acknowledged to be unstable or in danger of self to others. The red flag means that the guns are taken away by the police authorities. It has nothing to do with responsible gun ownership, but there is actually incremental success across the states at making incremental, but I think substantial progress. So I actually think that the bipartisan senators who are meeting right now to come up with incremental progress around mental health, access to mental health services, red flag laws, hopefully some registration and some background checks. Any of this is progress, David. And I would because we can't get the best solution doesn't mean we shouldn't take some progress we have seen across the country, even in red states as well as blue states.
All right, John. Well, I'll get out my magnifying glass to look for these incremental changes that you're touting, but I don't want to. I don't want to discourage it. It could crush it. Let's talk about how gun violence is affecting the medical field itself. Now, obviously, there was a recent shooting in Tulsa of a physician. A lot of physicians report they've been threatened with violence, and there's others that have been shot as well. One thing I learned that I was not aware of is that there's this frequent connection between pain management being a factor, and this ties in with the opioid crisis as well. The patient in Tulsa who shot his physician was complaining about back pain, and this ties in also sometimes to opioid seeking behavior and kind of the dual crises of gun violence and opioids. And of course, physicians have also been treat the people who are patients who are shot, treat them in the emergency room as well. So there's a lot of direct connection here. And I think, it was back in 2018 when the NRA said that, told the doctors to stay in their lane. And they basically said, this is our lane.
Well, the challenge you've got right now, I think is even more acute than that. You've got doctors who are just trying to fulfill their public health responsibilities, educate people about vaccines and deliver vaccines. And you've had doctors and public health officers threatened with violence. I mean, what we know is that when people lose their temper and issues do escalate, easy access to guns and ammunition for unstable people leads to toxic scenarios where people can really do a lot of damage and not just threaten. And I think it's really increasing the barriers to the unstable, limiting access. I think the ghost gun thing that you skipped over somewhat dismissively is wrong. I mean, I think it's in certain states, 1 out of every 4, 1 out of every 5 gun-related crimes is executed with a ghost gun because it's harder to trace. We need to make progress on that. And I think the other thing that's I mean, Matthew McConaughey's writing about this in U.S. in the news recently, that we need to talk more about responsible gun ownership and accountable gun ownership, because there's plenty of people who are responsible and accountable gun owners. What we're really going after is those who are irresponsible and increasing the barriers and the limits on the unstable, which and on criminals, which the vast majority of Americans actually agree on. 90% of Americans agree on red flag laws, on background checks. The majority of the NRA agrees in this. This is really a corrupt, broken part of our political system that we can't make progress on this. But major progress. But I don't think you should diminish the good work of incrementalism, even if you have to take out a little bit of a magnifying glass every now and then, because the arc toward justice and all that stuff. I mean, I don't think we honestly, David, we have to make progress. We're letting down our kids. I mean, it's crazy.
Sean, spoken like a true optimist. I don't know. There's all this approach on keeping guns away from mentally ill and so on, but a lot of it has to do with, John, people that are they're taking these involved in the mass shooting. They're not necessarily mentally ill. They're just angry, and they happen to have a tool around instead of putting a fist in somebody's face. That is deadly in the way that that was in a war that you'd be able to use. So I am not very optimistic about that.
Again, there's some great organizations that grew out of the horrible tragedy at Parkland, and one of them actually works with local police departments to help identify children, high school students, college students who are at risk of losing it, and getting them out of the mainstream and getting them the help they need. No, I actually think I happen to be very strongly in favor of gun safety, and I would be much more aggressive legislatively. But we've got a lot of angry, pained, and broken people. And I think if we can use the tools we've got to identify them and get them away from guns and to help with, again, that's progress, David. And there are hundreds and hundreds of examples where it has helped people not get into those confrontational situations that can lead to death.
So, John, we're 10 years after Sandy Hook. Gun violence has gotten worse. Laws have gotten looser. Now, in 10 years, it'll be 10 years since Uvalde and a number of other things. What will we be saying then? Are we going to be saying we made progress, we stabilized, we made incremental progress, or we continue to go backwards? What do you think?
Oh, I think we're definitely going to make progress. I don't quite know how. I don't quite know when we're going to see substantial moves, but every major move, whether it's around social justice, around peace, around innovation, the pressure grows for a long time, and then there is major progress. I also think the technology around how to make guns more safe, and making the identification of who's using them more clear will make it much tougher to commit crimes, and hopefully much easier to prevent the inappropriate use of a gun, of allowing a gun anywhere near a child. And I think we're definitely going to make progress. We can make progress today, and I'm seeing modest movement on the politics locally, modest movements in politics nationally. Let's build on that.
All right, John. So although I think you can tell, I will take the more pessimistic view. I really hope that you're correct. And so I'll say, I think we're probably it's going to continue to get worse. But I would say if there is going to be progress, kind of technology and the lawfare element of it, I think are both going to be necessary. We need some new techniques.
I think technology is going to help. And I think looking at this as a broad part of the healthcare crisis and the mental health crisis, don't sniff at that and look the other way. I think looking at this as a public health and a mental health problem and a challenge that we can address that way is a positive.
Well, that's it for yet another episode of CareTalk, and we've talked about gun violence yet again. I hope that we'll have some impact this time. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix. If you liked what you heard or you didn't, please subscribe on your favorite service.